If you notice more hair on your pillow, clogging the drains, or your hair feeling thinner, your first instinct might be to blame your oil, shampoo, or even your haircut. But if I told you your hair isn't actually the problem, it could be your body trying to tell you that something inside isn't quite right. Today, I'm going to reveal 5 surprising medical reasons behind hair loss. One of them usually starts 3 months before your hair actually starts to fall, and another is something almost every family blames. So let's begin. Imagine this: you recover from a fever, you deliver a baby, you go through a major surgery, lose a lot of weight, or even go through a stressful breakup. Everything feels normal. Then, 3 months later, your hair starts falling out. How can something that happened months ago suddenly cause hair loss today? This condition is called telogen effluvium, and it's one of the most common causes of hair loss. Normally, about 80 to 90% of your hair is actively growing, while only a small percentage is resting. After a major physical or emotional stress, a lot of hair are suddenly pushed into the resting phase. But they don't fall immediately. They quietly remain attached for about 2 to 3 months before shedding all at once. That's why people often blame new shampoo or hair oil when actually the real trigger happened months earlier. Once the trigger is corrected, the hair usually starts recovering over the next few months. But telogen effluvium is only one possibility. Here's something fascinating. Your hair might notice a vitamin deficiency before you do. Feeling perfectly healthy doesn't always mean that your body has everything it needs to grow healthy hair. One of the biggest culprits is iron deficiency, especially in women with heavy menstrual bleeding. Low vitamin D, vitamin B12, zinc deficiency, or inadequate protein intake can also affect hair growth. Hair is not essential
Uh-oh.
for survival. So, when your body doesn't have enough nutrients, it redirects those nutrients to more important organs like brain and heart. Hair follicles are amongst the
Aww.
first to suffer. But what about the reason millions of people blame every day? It's because of the hard water. You have probably heard it from your friends, or maybe you have said it yourself after moving to a new city. So, does hard water actually cause hair loss? The answer is not directly. Hard water contains minerals like calcium and magnesium. These minerals can build up on the hair shaft, making hair feel dry, rough, dull, and more prone to breakage. But hard water doesn't usually damage the hair follicle itself, which means that it isn't considered a direct and permanent cause of hair loss. If you have recently moved to an area with hard water, using a water softener, a chelating shampoo, and a good hair conditioner may help you reduce hair breakage. However, if you notice hair coming out from the root instead of snapping in the middle, it might be time to look for another medical cause. And one of the most common is hiding in your hormones. Your hair listens to your hormones more closely than you think. Sometimes the very first sign of thyroid disorder isn't weight gain or tiredness, it's gradual thinning of your hair. Both hypo and hyperthyroidism can affect the hair growth cycle. Women with polycystic ovaries may notice thinning over the crown because increased androgen hormones gradually shrink the hair follicles. Around menopause, changing hormone levels can have a similar effect. If your hair loss is accompanied by irregular periods, excessive facial hair, sudden weight changes, or unusual fatigue, don't ignore these warning signs. Treating the underlying problem is often just as important as treating the hair itself. But before you rush to buy expensive serums, here's one final medical cause you should know. Sometimes hair loss is simply genetic, where hair follicles gradually become smaller over time. Other times, it can be due to autoimmune conditions like alopecia areata, certain medications, recent illnesses, or nutritional deficiencies. That's why persistent hair loss should never be treated with guesswork. Hair is often a mirror reflecting what's happening inside your body. If your hair has been falling excessively for more than 6 to 8 weeks, you are developing visible thinning, bald patches, or you are losing more than 100 hairs per day, it's time to consult a dermatologist. The earlier the cause is identified, the better your chances of preventing permanent hair loss. If you found this video helpful, subscribe and share it with someone who is suffering from hair loss.